Unaendelea kutazama Citizen Town Hall ndani ya taarifa za Monday Report. Ni ugonjwa upi huu ambao umeambukizwa baadhi ya kaunti? Baadhi ya kaunti zimepata tiba ya ugonjwa huo, lakini zingine bado zinatafuta. Ndio swala ambalo tunalijadili hii leo kuhusiana na sekta ya afya, huku mgomo wa wauguzi ukiingia wiki ya pili. Maswali yako mengi hapa kutoka kwa wananchi na pia wauguzi kutoka kaunti mbalimbali. Nitaanza na David Temba. Tafadhali simama.
I'm David Temba. I'm the Deputy Branch Secretary for Kiambu County. My question will go straight to Bwana Governor. When we were negotiating, our CEC said that your county had been taken to court after having paid the nursing service allowance to the nurses. So my question would be, who were you taken to court and by who? My second question kindly.
Wacha ajibu hilo kwanza, Daktari Mutua.
I'm not aware of the county being taken to court. So maybe if we were, I'm not aware, and I don't think we've had any dispute in the courts because of paying.
Naam, swali la pili litakuwa linatoka kwa Saumu, ambaye nadhani hili swali linaweza kujibiwa na naibu gavana wa Nyeri ama pia Daktari Alfred Mutua.
Hello, my name is Saumu from Machakos County. I'm posting my question to the governor, not as a Machakos County nurse, but as a Kenyan nurse. Because every time nurses agitate for their rights and they are given responses like equity for people, for health workers in the same job groups, do they ever take time to evaluate whatever duties the nurses do? Do they ever take time to evaluate the odd work hours of shifts that the nurses do, that the counterparts in the same job groups don't do? Thank you.
Good. I think I can respond to that. The truth is, we are coming from very far in terms of staff evaluation. Like I alluded to, performance management systems. We for the longest time did not know how to evaluate your performance or even to match your specialization to your job. You will attest to the fact that some of you are sent, if you're an ICU nurse, you're sent to OPD. So one of the things like we are doing in Nyeri County, like I said, is to try and match your jobs and your specialization to what you do every day so that you're motivated. We're also coming up with a system, a performance management system, so that we are able to track who do we have, are they working, where are they working, are they motivated, and even a reward system, which has been lacking. We don't know how to reward you because we also don't know how to measure, what you've been doing. So those are some of the things that we are working on, and like Governor Mutua said, thanks to devolution, we are able now to work at these things from a county level. So it's good that you raise it, but it's also flagged, for instance, for us in Nyeri County.
It's a very good question because there are two stages. There's employer and there's employee. And what has happened, and this is why I disagree with my good friend about trying to take healthcare back to the national office, is that there was really discrepancy in terms of supervision and also getting to know the day-to-day challenges that nurses face. Maybe I'm luckier than most, but my nurses in Machakos, I'm proud of the way they work and the way they dedicate, their lives to their work. Yeah. However, you find that we are not able yet to match their willingness to work with the work environment. We are still trying to fix the environment within which they work. Yeah. And the environment, I mean, the conditions of work when they come to work, how they are able to deal with the patients, their security of work, because healthcare is also dangerous. You can get infections as you work and all that. But then also, we're also looking at systems where to ensure that, as you said, people are actually working and nurses are working. I don't know, in Machakos, some work, majority work. We've had challenges of a few not showing up to work, but we know that in Kenya generally, we have a laxity when it comes to employees, especially some public servants. you know, who don't come to work, who have other duties that they do outside work.
I'd like to hear from the Ministry of Health and nurses. They're here. They just joined the strike. Is there something that we don't understand? What is it that you go through that you think we should talk about in this discussion that is not being brought out? Because most of the time people are talking about, is it about the money, and life and money, which one comes first?
Thank you very much. My name is Imelda Achieng. I work at the Mathare National Teaching and Referral Hospital. When I talk of Mathare, everyone else understand what Mathare means. Most of the times we are stigmatized. We deal with mental patients. It's very risky. There is a lot that people do not understand about nurses and the healthcare workers. We do a lot, but we are never appreciated. We don't look for money. We don't look for money, but at the same time, we have to be appreciated. We have to be remunerated well, because we have families. We have needs. I'm a nurse. I need to dress well when I'm going to work. I need to eat well so that I'm energetic when I'm dealing with the patients. I need to be stable socially so that when my colleagues are also having one for the road, who said that a nurse should not have one for the road? Who said that a nurse should not drive the big machines? Who said that a nurse should not be flying home to land in...
Which one comes first? Is it life?
It is the life, yes.
The remuneration packages.
It is life, yes. But the needs, it's almost going 50-50. Because if I'm not comfortable, I will not deliver.
All right.
I will not come to work when I'm stressed. I've left my child is not going to school because I don't have money to pay the school fee. And you want me to come and work and take care to the of the patient. Will I deliver that? I'll be carrying all the stress back to work. And when I come from work, I've left that patient suffering because I didn't do it well. I'm also socially disturbed. I'm also not feeling well that I've not delivered properly, but not because I like it, but because I left something else that is disturbing me behind.
All right. And
to jump in, and it's good because, you know, what we fail to appreciate in Kenya is that employees, even though they're giving their energy to serve, they're also human beings who need to work. And I think it's a combination. And I'm lucky if I can use Machakos as an example. I know other counties have done it, but I think Machakos is the only county whereby all my employees, including the health workers, it started with the health workers and my discussion with my wonderful nurses, whereby you found that a doctor or a nurse is not able to get their child treated. They don't have insurance. They're treating people, but they don't have insurance. So we have NHIF, but also Machakos, we also got enhanced NHIF for all our employees, so that any employee of Machakos County, if your wife is sick or your husband is sick or you are sick, you can go to Aga Khan or Nairobi Hospital or Karen, the expensive hospitals, and actually get admitted and treated, and also go back to your hospital as you fix it up and get admitted in Machakos and be taken care of. So we want to ensure that life is balanced, so that we can have, you know, standards that are good, both national and county.
Dr. Uma, you know, there's a bigger problem here. It's not just the welfare of the nurses and the doctors. There's also the issue of infrastructure. We've seen misdiagnosis in hospitals. So there's a bigger problem. In 2001, the Abuja Declaration, where Kenya is a part of, we said that we're going to dedicate at least 15% of the revenue to healthcare. So far, we're doing about 7% or even less. So there are bigger issues than just the human resource issue.
Yeah, thank you. I think before I answer your question, I almost wanted to say that I think Governor Mutua is really threatening to take over my job. And I would be glad for him to do so. In fact, I think I will, I hope my branch officials are also watching. I think I'll send them to his office also, so that they can pluck a few of these goodies. But thank you, Governor. One of the things, and I'm saying this on a very serious note, and I was telling the Deputy Governor, before strikes happen, it is not just the issue that's on the table. For example, our CBA, we signed CBS. And there are counties that are implementing the CBA, and there are counties that are not implementing the CBA. But there are counties that are not implementing the CBA, but we are in very good relations. And you find that because they keep engaging us and telling us we are unable to do this at this particular time, even though we agreed, but we are unable to do this at this particular time, please give us more time, or can we do it in a different way? One of the things that, and the reason why I'm emphasizing what Governor Mutua is saying, is that relations between employers and employees is actually very important. So you may find that counties or generally places where workers are abused, where their bosses do not appreciate them, even a small issue that could otherwise be solved through dialogue is unable to be solved through dialogue. And this is what we call social dialogue. Coming back to your question about the bigger issues of healthcare. Right now, there's an AU meeting of the presidents, and they are discussing investments in healthcare. Over the last 2 years, WHO has changed the terminology, or basically the phrasing for money into healthcare to be termed as an investment. And because they're saying it's been discovered that if you put $30 per person in a population, then you, over about 5 years, you can actually get returns of up to $100 billion in terms of dividends, because only a healthy people can produce. If you have, for example, today in counties where these nurses are on strike or health workers are not performing well, you also will find that the lifespan in those counties are very low. You will also find that the people in those counties take more sick offs because they have to seek health care more often. Their hospital stays are longer. So they are not out there to produce. And this is actually eroding economic dividends for countries. And that's why in 2001 there was this declaration, the Abuja declaration, to finance healthcare towards 15%. Not because other sectors of the economy are not important, but first and foremost you need a healthy population to produce whatever it is. But now we're even talking about percentage of GDP. In the presidential meeting in the AU, they're talking about moving towards 5% of GDP for health. You find most of the African countries, we are still at 2%, 3%. And the other problem is that we are also a bit inefficient in the way we spend health budgets. So in Kenya, we did a research in 2015, 2016, and we found out that 29% of all health funds at the county level actually go towards corruption. So we lose a third of the health budget already.
Well, that is the statistical bit of it, but how much of this is to blame on the health practitioners themselves? So we've also seen misdiagnosis.
Yes, that's what I'm talking about. First of all, we are talking about the investment in the health sector. So the 70% that is remaining is also not spent efficiently. So even if it were to be prioritized, you will find that we can still gain up to 40% of this amount of money. And let me talk about the issues of the health workforce. The health workforce anywhere in the world needs support, and they need motivation. And healthcare is a bit complex. It's a bit complex for two reasons. That when you as a person are sick and you go to a hospital, it could be a million things. Let me use the word a million things, because the differentials for what you could be suffering from are so many. The way cancer presents and the way malaria presents is not different, for example, you know. So if a health worker is not supported with correct tools, and tools could actually be skills as well, you know. So if you go to Mbagathi or you go to any other hospital and you're sick, but this health worker has not been constantly trained and put in the right frame of thinking to be looking for what you're suffering from, they are definitely not going to get it.
So you're going for lack of infrastructure rather than incompetence?
It's not really incompetence. You've not been put in the right skills to get this. And that's why part of the organization and the work that now I'll be doing globally is actually talking about access to skilled health workforce.
All right. Let me bring in Seth. I see you want to jump in on that. And
you are insisting on this thing of misdiagnosis.
Because it has happened before. We had a story just before we came here.
I want to say they happened.
Yes.
But I want to respond to you candidly because there are certain factors that must be considered when you talk about misdiagnosis or medical malpractice. One of the things you must first of all ask yourself, is this professional negligence? You get an answer on that. Is this professional incompetence? Is this systemic failure? So once you answer those three questions, then you'll be able to approach and correct where it's supposed to be corrected.
Okay. So what he means by systemic failure is that I, as a healthcare worker, I was not enabled by the tools that I had in the hospital to find the correct diagnosis for your problem.
Hold on to that thought. Let me bring in the audience on this if they have any questions, Mashirima.
Na tumesema mengi kuhusiana na wauguzi, lakini hebu sasa tusikie kutoka kwa wale ambao wanaenda kusaka huduma za wauguzi. Clive, simama tafadhali.
Kwa majina naitwa Clive na swali yangu ni kwa katibu mkuu wa nurses Seth Panyako. Ulisikia serikali ya Uhuru Kenyatta hivi majuzi wakizundua ile mpango ya universal healthcare. Mbona wakati hiyo huku kuja mbele ukasema hauja solve mambo ya CBA yetu na unaleta ingine? Mbona ikuje saa hizi? Asante.
Panyako, naomba ujibu hilo swali kabla tuendelee.
Unajua wakati walizundua hiyo mambo ya universal health care, tulikuwa tuanze mgomo tarehe 10 mwezi wa 12. Lakini kwa sababu sisi tuliona kwamba hatutaki serikali ione kwamba sisi kama wauguzi tunaanza kukandamiza universal health care, tukasimamisha mgomo huo na tukaahirisha, tukasema utaanza tarehe 4 mwezi wa pili. Na ningependa kukuambia kwamba huu mkataba ambao tuko nao, rais mwenyewe akiwa State House alitoa, in English, had an input in that agreement. SRC ilikuwa bado iko, na hata kuna mkutano ambao ulifanywa na SRC na serikali zote mbili na wakakubaliana tupewe hiyo. Ile kitu ilikuwa imebaki labda kwa system zao za serikali, wajua sisi hatuna uwezo ya kuongea na SRC. Ilikuwa ni walete barua ya mwisho kusema kwamba tulikubaliana na haya maneno, kwa hivyo muendelee kulipa. Lakini kwa bahati mbaya hao commissioners tamu yao ikafanya nini? Ikaisha. Hao wengine kuingia wanaanza kurabish yale yalikuwa yamefanywa na ile commission nyingine. Kwa hivyo sisi tunapenda nchi hii, na ndio unaona tulisema kwamba itakuwa ni aibu na itakuwa ni vibaya kama sisi tutaanza mgomo siku ile rais anaanza kulaunch universal healthcare coverage. Na sisi wenyewe tulikuwa Kisumu, nilikuwa na chairman wake, nilikuwa na naibu wangu na viongozi wengine kule Kisumu, rais akizindua. Hata hatukutambuliwa huko kama stakeholders, sababu wale walikuwa pale mbele nafikiri ni wale wa kutafuta pesa, wale watu entrepreneurs walikuwa wamejaa hapo mbele karibu na rais. Lakini sisi ambao tunafaa tuwe karibu na rais, ndiye anatunongonezea, anasema na hii kitu yenu usiache hii mkomo kwanza. Tumewekwa huko, tunakaa mahema karibu na barabara huko. Lakini wale entrepreneurs ndio wamekaa karibu na rais, wanasema sasa hii vile zinaenda, nataka nilete hii machine, nataka nilete hii. Hiyo ndio shida, ugonjwa tuko naye katika nchi hii. Sisi tulikuwa tumekaa huko na madaktari huko. Lakini wale ukiona pale mbele unaona entrepreneurs.
All right, next question.
Asante.
Kuna jambo moja ambalo ningependa kuchangia kidogo, ambalo uliuliza, alafu ndugu zangu hapo wamehepa kidogo. Wamehepa, lakini lazima tutambue kwamba pia katika nchi yetu kuna wauguzi ambao hawafanyi kazi, na pia tuna hiyo kasumba ya watu ambao hawatokei kufanya kazi. Ni vizuri tutambue hayo. Ukienda kwa hospitali zetu wakati mwingine utakuta madaktari hawapo. Alikuja akaingia dakika 5, dakika 10 akatoka, akaenda clinic yake. Pharmacist amekuja kufanya kazi, ameenda clinic yake. Hivi juzi nikiwa kule Machakos, nilitembea kule nikakuta ya kwamba kuna pharmacists, kuna laboratories ambao zingine ni za wafanyakazi wangu. Wanahudumu sana kwa hizi private clinic zao, hawahudumii wananchi. Kwa hiyo jambo ambalo tunatambua ni kazi, ni jambo ambalo lazima tukubali ya kwamba pia hiyo shida ipo ya watu wanatafuta pesa kila wakati, bado wanataka kula upande huu na wanataka kula upande huu. Umeona?
Alright.
Inakuwa ni shida ambayo imenisumbua sana mimi Machakos, najua Nyeri na kwingine pia.
Yes, and I think I want to agree with you, Governor. And I think the mood of the country and the spirit of the president is clear with regards to conflict of interest, with regards to those who are running parallel organizations to what the government is trying to do. And I also listened to the two gentlemen sort of maneuvering out of that issue. And you know, we have gotten to a point where we're asking ourselves, like in Nyeri County, I asked for the age profile of, for instance, our nurses, and I was told that close to 50% of them are 50 years and over. So you begin to ask yourself, is it an aging workforce? Are they lethargic? Do they need, you know, do we need to sit and say, you have done a great job, goodbye, and let's get younger people? We're beginning to ask, what is it? Because, you know, if sometimes the attitude, even the attitudes when you come to government hospitals, sometimes are just downright wrong. Okay. You know, we say the first pain of a patient is first that they are unwell, that they should come to a hospital and you give them the second pain by even sometimes throwing words. And we get those videos sent to us. So you know, sometimes we wonder, is it time? You know, is it, you know, what exactly could be going on?
Okay. Or system failure also.
Or is it a systematic issues?
Uma, before you respond to that, there's two more questions from the audience, and I see a lot of reaction from them. Let them ask their question. You will respond just now. Mashirima.
Naam, hebu sasa tupate nafasi ya kuwasikiza wale ambao wamefika hapa kuuliza maswali. Nancy, simama tafadhali.
Kwa majina yangu ni Nancy Joki from gov't South. I'm CHV. Naomba magavana siwaongee pamoja, warudishe sekta yote ya health kwa national. Maana tumesikia mgomo ya madaktari mingi sana. Sisi kama CHV kwa community tunalifaa patient kwa hospitali, tukikosa madaktari tunasikia vibaya sana. Na ni sisi tuko kwa community. Kwa hivyo wakirudishwa kwa national, sisi wananchi hatutaumia.
Naam, kabla ya hilo swali kujibiwa, labda tupate la Clean Adisa. Simama tafadhali.
Okay, naitwa Clean Cute Adisa. Swali langu linaenda kwa mheshimiwa kabisa na nataka unijibu vizuri kabisa.
Ndio.
Swali langu ni hivi: kwa nini idara zingine zikigoma hapa nchini Kenya, jamani, huwa zinashughulikiwa haraka kama gari ya miraa, lakini hii idara ya nurses, jamani, ambayo imeshika uhai wa binadamu, huwa haishughulikiwi mpaka ona hili ni wiki la pili? Asanteni.
Naam, na swali la mwisho ni la Kiruja Jason. Kiruja, uko pande gani?
So my name is Kiruja. My question is to the Honorable Governor and maybe the Deputy about the same issue I've been discussing about the Health Service Commission. Today, the COG is a Tower of Babel. So where will we get the coordination that will get the coordination of the health service around the country? I'm sure you've been oriented on universal health coverage, and key to universal health coverage is equity and standardization, which is quite lacking. Even here, I've just seen the last report from the Minister of Health. Your ratios for per population are quite impressive. I will not say that about Nyeri. They are quite almost half of what you got in Machakos. So definitely you are lacking in equity. So would you support Health Service Commission?
Thank you. All right. Labda hayo maswali matatu yanaweza kushughulikiwa kuhusiana na tume ya huduma kwa afya. Kuna swali lingine kuhusiana na ni kwa nini idara zingine zikigoma unapata kuwa wanahudumiwa haraka. Alafu swali la tatu lilikuwa la Nancy akiuliza kama mnaweza kutaka huduma za afya ziweze kusimamiwa na serikali kuu. Trevor.
All right. Go. Yeah, you wanted to go first.
I think, Trevor, I wanted to say that
very briefly because we're running out of time.
Today I'm not speaking much because I think the Wananchi are saying, you know, they are speaking on our behalf, and then especially Nancy talking about the community health volunteers because they see these things on the ground. Yeah. You know, sometimes counties they blow so much of their trumpets, but the Kenyans know what is ailing them. And I think you have repeated the same question, and I wanted to mention that there are three fundamental things why we need the Health Service Commission, and it is not so that the health care can be taken away from the county governments, and it is not for the reason that the national government can manage health care better than county governments, for 3 fundamental reasons. One is what we call global health security. If you are having a county, for example, like right now, Nyeri, where workers on strike, and Machakos workers are on strike, if there is a health outbreak, a disease outbreak in Nyeri, it will go to Machakos. So Machakos is not protected by the fact that their nurses are not on strike. Number 2 is the issue of equity. Resource equity and health equity. Resource equity in the sense that not every county is endowed to have enough finances to manage health services, and not all the counties will be capable of attracting specialists or skilled health workers. For example, Kirinyaga may not have the need for a neurosurgeon, but every day there are border riders in Kirinyaga who may get an accident and get a head injury. It does not mean that the Kirinyaga residents do not need a neurosurgeon. It is the way with the health services should be reorganized at a level with the Health Service Commission, so that the person in Kirinyaga is assured that when they have this accident, they can access a neurosurgeon, even when Kirinyaga County has not employed or does not need a neurosurgeon. Number 3 is the issue of, I mentioned, resource equity. And resource equity comes both from the fact of finances, but also from the fact of infrastructure. For example, it may not make a lot of sense for Nairobi here to invest so much in health infrastructure when they already have hospitals all over. And it may make a bit more sense for places like Mandera, Wajir, Siaya that are a bit sparse in terms of health facilities to have much more resources. And these things can only be solved from a point of Health Service Commission. And I think we may need to have this conversation with the governors so that it is a sub-national supra-county, and it will solve. I asked when I was here, for how long will we come here to be discussing issues of health?
Let's bring in governor on that, because we're running out of time here.
I'll be very quick. Nimeshangaa sana, sikuwa najua kwamba gari za miraa zinashughulikiwa kuliko gari zingine, lakini sasa nimetambua. Lakini kuna swali pia tunapaswa kujiuliza, na ni hili: je, katika kazi ambayo inafanywa na wauguzi wa afya, na tukiangalia kwamba afya inashughulikia hali ya maisha, na sisi unazaliwa na unakufa siku moja, na ukienda haurudi. Je, kwa nini wauguzi wanagoma katika nchi ya Kenya? Ukienda Marekani, ukienda Europa, ukienda Japan, ukienda Russia, ukienda nchi za South America ambazo ziko na shida zingine, you never hear of health workers going on strike. They never go on strike. They may do a go-slow, but they never go on strike. So it is something fundamental that we need to look at, whether also there is a responsibility by nurses, by doctors and others, where you down your tools and people actually die and they're not going to come back. Even though conditions may not be up to standard, it's a debate and a consciousness that we need to have. Because people, and I see nurses working very hard, nurses, doctors are not doctors because they want to make money. They are not nurses because they want to make money. It's also a service. They wamejitolea kwa maisha ya wananchi. So should you go on strike in the same way? Should the police go on strike? Should the military go on strike? You know, you can find, yes, others can go on strike, but should we pass legislation and say you cannot go on strike? You need to have, you can go on a, you can have a go-slow, you can have a negotiated go-slow that has an impact, but to go on strike such that you walk out of ICU and all the people in ICU just need all die, is that really right even before the eyes of the Lord and God?
That's a fundamental question. Is it worth it?
Is it right in the eyes of the Lord?
You know, when you say sit right in the eyes of the Lord, I'll ask you, have you ever as a human being taken care of an adult mwenye ameenda jo amechiharia, wewe unamsafisha, unamtengeneza, unapaka yeye mafuta, unamvalisha napkin, unamweka pale?
Isn't that a more reason why you shouldn't
that is where we say nursing is a calling, because to do that is not about money. It's not about money. There are things that You do not, because no one can pay you for that. And in the word of the former CS for Health, Dr. Cleopa Mailu, he said, Panyako, let us get an allowance to appreciate nurses for the kind of work that they do. And he said in his own word, na kwa Kiswahili, wewe Panyako unafikiria mtu wewe kutoa mavi ya mtu mzima, unamsafisha paka anakaa mzuri, hiyo si kasi ya mchezo. Na hakuna mtu anaweza kulipa wewe hiyo. Let us look for this allowance. And that is how we arrived at the nursing service allowance. I remember it was 1 a.m. when I was discussing with him. People were asleep.
So should it be passed
then that money was done to be paid for everybody else. What we are saying is this. Look at Moi Teaching and Referral Hospital.
Yeah.
It's a good example in Kenya. I've had governor speak and I'm worried. He inherited 1,400 nurses. He has 800. She has 800. Yet she inherited 1,400. Where are the rest? Natural attrition, retirement, he has not employed even a single nurse.
Yeah.
How do you expect a account like that to be even caring about her own citizens? Moi Referral is a good example because in Moi Referral today, as we are
I'll
talking,
respond to that.
As we are talking today, workers sit on the depot with the management the way His Excellency sits with my officials and they discuss issues. That is why you don't hear these problems in Moi Referral, mix up of what, patients, children missing, what and what have you, because the doctors union, the nurses union, and the domestic workers union will sit with the management and they have signed the CBS, they have signed the recognition agreement, and they will discuss on how to move that hospital forward. So we want to move away from these things of fighting for a CPA that we have agreed many years ago. Why can't we implement it so that now we are incorporated in actually management of the healthcare system in our counties, so that if a problem happens, it is going to be my responsibility, not the responsibility of the county government alone.
Okay.
Good. Let me respond to the issue of
the number of nurses.
The number of losses of nurses that we have lost. It is a fact. Most of them through natural attrition, which for us, like I said, is a good thing. We're still left with 50% of 50-year-olds and over, and like we said, we are beginning to ask: are they, do they need to retire? It's a question that we are beginning to ask ourselves.
The shortage.
But what are we doing?
The
let me respond to you. I'm speaking.
I beg to interrupt.
How can it be a good thing?
Let me
It can't be a good thing.
Let me respond to you. What we are doing about it. The thing is, you cannot employ who you cannot pay. I can tell you 85% of our health budget goes to recurrent expenditure. Out of that 85%, 98% of it goes to salaries and personal emoluments. Now you cannot, we cannot employ who we, then we will be in another problem, with everybody. So we are taking it in stride. And just, I think yesterday we advertised for 100 nurses. I'll be pleased to let you know that by the end of today, we have received 30 applications.
But you're threatening to sack more. They don't go back to work.
Of these nurses. So there is appetite. There is appetite. But we can only pay for who we can pay for.
Okay.
We cannot buy it.
I think not just in defense of Nyeri. The reality is that we are strapped for cash in counties.
Yeah. That's right.
We are strapped for cash in this country, in terms of we really do not have enough money to meet all these things, but that is why we need to have a bigger discussion
about funding
and also about corruption, because unajua hizi pesa zingine unasikia zinaenda na magunia usiku in our country. If some of the
kama zile za container ziko Mombasa,
if some of the senior people in this country and others stopped eating the money that belongs to the people, and we saved the money, we'd be able to take care of the teachers, the doctors, the nurses and others. So there's also a bigger problem that we need to sort out. Daktari, and I hope you'll say that doctors should never go on strike.
I need to respond to that. I think Governor is very right. I mentioned already that we as KMPDU and SID and KELIN and Transparency International did actually a research, and 29% of money meant for health of wananchi is actually stolen. 29%, and this is data that is available. Now, I think if we reduce on our corruption, we will have enough money to employ everyone. Right now, even the number of doctors is going down, and yet we have a lot of doctors who are available to work and to be employed. And even the 70%, if it's used efficiently. But I wanted to respond to something very fundamental that the Deputy Governor mentioned. Trevor, today you are a bit unfair. As 5 seconds.
Yeah.
So the Deputy Governor mentioned something that is fundamentally, I think, maybe she would have put it in a different way. Or if she believes that way, there's nothing wrong with 50-year-old people. Yeah, and I think at some point I'm very privileged to be a bit young, but at some point, God willing, I will be 50 years. I don't think there's anything wrong. In fact, the president himself has been appointing people who are 70 years into Passato. But there's nothing wrong with that. But I think there's also something called workforce planning. Workforce planning means that you know at what particular point and for what function is appropriate for the ages. Right. And that's what has not been happening. So I think Nyeri needs to do a bit more workforce planning. But also if you're losing nurses because of natural attrition and retirement, the money that is meant for them, why are you not using it to employ more?
All right.
We are.
Let's bring in Mashirima on this. We've really run out of time, ladies
and yes, doctors and nurses are employees. So as long as they're employees, conditions of employment apply to them, including a strike.
All right.
Good.
But
just one thing to just clear the issue of age. I am not averse to 50-year-olds working. I actually think they are very experienced.
Okay.
I am averse to the attitudes that with time they carry, and it's something that we have observed because they have seen so much happening to a point that very little shakes them. Okay. So that is where I'm coming from. It's from an attitude perspective.
All right, we have to leave
Thank
it
you.
there. Mashirima kwako sasa.
Nadhani mjadala moto sana ambao hauwezi kumalizika leo, manake maswali yako mengi. Kuna wengi ambao wanahisi hawajasikika. Kuna mmoja ambaye anasema yeye ni muuguzi, kuwa katika migomo iliyopita hakugoma na hata kama wenzake hawakulipwa wakati huu wanagoma. Mwingine anasema yeye ni muuguzi, babake anahitaji usaidizi na huduma za wauguzi hospitalini, lakini amekwenda kwenye mgomo kwa sababu kuna masuala kadhaa ambayo lazima yashughulikiwe. Ubaya tu ni kuwa muda haunasi, sijui itabidi tutafute awamu ya pili. Trevor.
Kweli kabisa Mashirima, na Kiswahili yangu imeishia hapo. We may have to actually get another session for this discussion because healthcare is such a wide issue, and we can almost promise you here at Citizen that we'll have this discussion again and find out what really is ailing the health sector. How does this end? We will see how it works out. As for Nyeri County, we'll find out if the strike will be called tomorrow. Like you said, it will be called off.
Of course, with the commitment, we expect it to be suspended tomorrow. We are not calling off for Nyeri. We are suspending so that when they pay, then we call off.
All right. That's where we leave it. Thank you so much for tuning in to Citizen Monday Report and the Town Hall session. My name is Trevor Mbija, and thank you so much for everybody who made time to listen to us. And the discussion doesn't stop. Continue online. We must have this discussion talking about healthcare and find out the solutions that we have. Bye for now.
Trevor Mbija, Mashirima Kapombe, great discussion there. All stakeholders had a chance to have their say on this particular topic. But as some have asked, we certainly hope that this discussion will mean relief, hopefully in the short term, as soon as possible, for the patients who are suffering because of the nurses' strike, which is now in day 8. In the next couple of minutes, we'll actually be on to day 9 as well. This is some of your feedback before we wrap up the program today. Let's see what you are saying in terms of your messages here. I believe we have some tweets. Okay. We should have some tweets in just a bit. Let's see here. Okay, let me see if I can do that one last time. All right. Well, who knows? Sometimes I tried. Sometimes they work. Sometimes they don't. Let me do one last try here. We did have some tweets here, but it seems that we will not have them for now. Thank you so much to everyone who's taken time to watch this program today, and of course who's made this program possible as well. You have been watching the Monday Report. My name is Wahiga Mwaura. Have a good night, and of course keep it Citizen TV. Goodbye.